Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. With me today, our guest is Tony Stajduhar. Tony is the president of Jackson Physician Search. Since 1978, Jackson Physician Search has helped recruit and place thousands of physicians nationwide. Needless to say, they clearly understand physicians' mindsets. Today, we're here to talk about the results of a recent study they conducted on the physician turnover epidemic. Now, I've had a chance to review these findings, and this is not an episode you want to miss. Welcome to the show, Tony.
Thank you very much. Appreciate it.
Now, let's talk a little bit about this study you recently conducted. What sort of prompted this study to begin with?
Well, as we meet with clients and hear from them daily about their needs and what they're looking forward to the future, it's always the acute needs that they have. But in most cases, these needs are to replace somebody who has been there before. It could be a physician that was there for a short period of time. It could be a physician was there for a long period of time and retiring. So we said, what is the concept around this? What could we do to try and help people in hospitals, medical groups understand what they could do to cut down on the number of recruits that they have to have. So if we can cut back on attrition within a group and help them achieve some of those goals, maybe it would make sense for them, and maybe some of the percentages of replacements over the years might go down. But not much has been done to address this over the years. So we thought, let's just talk to physicians, let's talk to people on the other side, hear what they're both saying, and see if we can't come up with maybe some solutions or identify some problems that might be out there.
Wow. Now, in the study, you noted that the average recruitment cost can add up to upwards of $250,000, with lost revenues exceeding, potentially over $1 million. Not to mention all of the time and effort involved in the recruitment process. With that in mind, do you believe there should be more of an emphasis placed around retention programs?
Absolutely. We have seen over the years some practices that do these things very well. And those that do typically have physicians stay longer, they have better productivity, they have better patient satisfaction, and so on. So all of these things add up to a tremendous amount of money in terms of lost revenue if they don't have these things in place. It also helps give a voice to physicians. In their mind, they feel like if there's a retention program and they're brought into that they have a voice into how the practice might be run or how their distribution of medical care might come across. So these are things that are really important, and physicians want to feel they're a part of an organization. They don't want to feel like just a provider. They want to feel part of an organization.
Now, since we're on the topic of recruitment and retention, what is the average annual physician turnover rate?
Over the last 30 years, it is like clockwork. It's usually somewhere between 6 and 7%. Usually closer to 6, but every once in a while it'll creep up a little bit to 7, but it's pretty consistent. But that means it's over 50,000 physicians a year or relocating.
Right. And do you, obviously the last year has been a trying time for all of us. Do you think that number will potentially increase or decrease because of this COVID pandemic?
Yeah, that's a great question. I don't think you'll see those things move as much as you might think. Okay. You would think under the circumstances that it would take a lot of physicians to really move that dial up to 8%, for example. And what you're seeing right now is a little bit unusual in that probably the last 6 months or so, it's one of the first times I've ever noticed that there seems to be more physicians than there were positions to be filled. So everything kind of shut down on the hospital side and some of the practice sides in terms of recruitment, just because there was no elective surgeries going on, money was tight, so physicians were hospitals were kind of cutting back, and there were physicians left saying, I need a position, I need to make a move, but there weren't enough positions to fill it. So I told people about 6 months ago, I said, enjoy this, because this has never happened in history, and it will probably never happen again. So now we're already seeing in the beginning of the year that things are opening up again. People are getting back on their medical staff planning and so forth, things that they had to put aside for a little bit during the pandemic. So it remains to be seen how things obviously go between now and the end of the year, but there's that optimism that people are starting to recruit again and get back on their plans.
Now, one of the things I love about the study that you conducted is that there's tons and tons of data, and I love all of that. For organizations looking to recruit, should they hire for clinical acumen or for cultural fit, or maybe a combination of both?
Yeah, my answer was going to be yes, but yeah, a combination of both. Just because physicians are, you got to remember, for the most part, they're scientists, right? They are very good with that part of their brain, and they're also very good about wanting to help people. So being able to find those people is not as big of a deal as the cultural fit. So how are they going to fit in? Sometimes there's certain specialties, we won't get into it, but there are certain specialties where your personality and your style and the kind of culture you fit into really don't matter that much. If you're sitting behind a screen and you're reading tests and things like that, not such a big deal. But anytime you're patient facing, you
Okay.
need to have some bedside manner. You need to be able to make the patient feel comfortable, that they're getting good care and that they're working with somebody who actually cares about them. So those things are all important. And also trying to find people who seem like they can fit into, if you've built a good culture, you want to bring in people who can fit into that, because the last thing you need, no matter how good a physician is to find somebody coming in and being disruptive to that culture. So you work really hard to build that culture, and you certainly don't want to mess it up with one candidate just because you need a physician. So it's a good mix. It's a good mix of the two, but that's why you do interviews. That's why you do things like this. You can do initial interviews over the internet, and then you can follow up with face-to-face interviews and just see how it feels, see how they feel about you, and vice versa. So yes, it really has to be a good cultural mix, but you still have to find good physicians at the same time.
Now, this is one of the stats that stood out to me. And when we're talking about integrating people into a culture, 32% of respondents noted that there was no formal orientation program in place. Does that mean that organizations are essentially failing from the start?
I would say, without trying to make it too dramatic, I'd say the answer to that to some level is
Mhm.
yes. Let me give you an example of a group that we do a ton of work with in Georgia, and they were literally just in my office yesterday. So we talked about things and what they do. And even though we've been working with them for quite a while, we never got this in depth with them on some of the things that they do when a physician starts. So they literally bring, and this is a doctor, this isn't even a PA, this is a doctor who's coming in, and they take 2 weeks of just getting them up to speed on EMR, getting them up to speed on culture and things like that. Then they start shadowing some other physicians, and they watch what they're doing, and they're helping them scribe so they can get involved and see how the patient flow works and how the working relationship is with their PAs, et cetera. And then another 2 weeks of going to say, well, we're going to do this, and then come back and let's talk about it with the physician who's kind of monitoring you, if you will, for a short period of time. But they're taking like 6 to 8 weeks where virtually a doctor that they're paying a lot of money to is bringing them almost nothing. But they believe that by doing that and getting the orientation and getting them in tune with what the group does, how they work, will get them up to speed much quicker in that way. And it also makes them feel like you care enough to put that much time and investment into them, to be able to ultimately produce. So that really opened my eyes to some of the conversation we're going to have today, to say they've got this figured out. They do a really good job. And guess what? Hard to believe, but their retention of physicians is outstanding. It's really, really good. But then you hear comments in the study that we did, a physician saying, yeah, they just said, here's the keys, good luck, God bless you. And, let's go get them. So that doesn't give you a lot of sense of security, I think, as anybody coming into a company. Even with us, we have I just can't imagine bringing employees in and doing no orientation, yet it happens all the time.
Yeah. I mean, when you really think about it, we noted this earlier with the $250,000 average recruitment costs, and to do it properly, you're saying potentially, another 6 to 8 weeks of training to do it the right way. It seems like there definitely should be more of an emphasis on retention. What are some of the ways that organizations can further engage with their physicians to help
Yeah.
with that?
Yeah, that's good. And you know what? It's interesting. In the study, you probably read that there are a lot of practices that do have a quote retention program. Yet when you speak with physicians on the other side, many of them, and in this case, most of them don't realize there's a retention program. So, think you've got an administrator over here saying, oh yeah, we got a great retention program. And the doctor over here going, where do I find that? Where do I find the reference to the retention program? So one of the things that you have to do if you really want to have one that makes sense, you build a program, build it to say, what's the end game? What am I trying to get to? And go backwards and build your program around what you're trying to accomplish. When you're doing that, you have to really make it public. You have to get physicians involved. Ideally, you bring physicians in to be part of that planning and how you build it. And then you have meetings to follow up about these things and let people know, make them aware of what's in place to show that you care about them. You show that you care about them staying and their livelihood and how they're feeling and how they're doing. These are all things that are really important. And the saddest part to me is that as many programs as there really are in place, and I'm sure these people are trying to do a good job of putting a retention program there, but if your physicians don't know, it's useless. So that's where there's a big disconnect. So the big question is going to be going forward, how do you fix that? Do you trash it and just restart and try to do it from scratch? There's probably 10 different ways you could go about doing it. But at the end of the day, if you don't get your physicians involved, it's not going to do you a whole lot of good.
Yeah, I'd imagine if the physicians don't necessarily know that it even exists, it might as well not exist because
Exactly.
Perception becomes reality. And then you add to that, the fact that over the last year, we've had to deal with this global pandemic, which ultimately could lead to a lot of physician burnout. Do you think the pandemic will cause sort of a mind shift change potentially in the physician community?
Yeah, it's definitely caused a tremendous amount of angst. Causes a lot of angst just in the general population. I look at our organization, we have 1,200 to 1,400 people on our campus probably, and we're running with a maybe 30% crew and just trying to be safe, and you're thinking about, so it's in front of mind right now. It's affecting all of us, because we love having this beautiful campus and doing the things that build the culture and make us all successful, but you do what you have to do. That's just coming to work and dealing with your coworkers every day. We don't have to come to work and deal with people on ventilators and people dying and seeing people carted out every day, on gurneys to go to a makeshift morgue. So these are things that, if you think about what they're doing and you think a doctor, over the last 12 months now, I guess it's been, many of them have been in a position where they come in, they see deathly ill people, the hospital's full, and all of those people are very, very sick. And then a lot of them are dying. Then they're going home at the end of their shift. And in many cases, they're going home to empty homes because they don't want to live with their families. They don't want to take the chances of passing COVID onto them. So they're lonely. They sit there, they think about the crappy day that they had, and then they go back and look forward to starting it all over again the next day with exactly the same thing. And just a couple of days like that would be one thing. But when you go through months of that, even when things start getting better, the angst and the things that are put upon you during that time kind of make you feel like you're flinching every day, just saying, can I get through another day of doing this? So yeah, burnout, PTSD, whatever you want to call it, it's real right now. However, I say all that, but I don't know that it's going to dramatically change physician movement. I don't know that that's really going to happen. I think you've seen things over the years when you see things happen. You saw it 9/11, you see recessions, you see the ACA, all the different things that have happened. It always emits an emotion from people and from physicians in that general population. And they have comments, they have feelings, but usually it ends up some point in time subsiding. And they start saying, okay, well, I'm still a doctor. I threaten that I'm going to leave the practice of medicine, but in reality, what am I going to do? I trained, 30 years to do this, and now here I've been doing this most of my life. What am I going to do next? So, usually they will come back around and things happen, but I will say the effect of what's going on with them and the death and dying and things that they're dealing with right now, I think will have a mental impact on them maybe not so much it's going to change the patterns of relocation to a great extent. Maybe, some small things will happen, but still, these are things that you have to deal with. And when you talk about retention, that's another thing you could put into a good retention program is mental health, and how do you help physicians through this when they need it and give them an outlet to be able to go to and seek help.
Yeah, I mean, you just keyed in on something that I think is very, very important, especially with the number just surpassing 500,000 deaths nationwide. It's an alarming statistic over the past year. And mental health, obviously, being an important aspect of that, especially when it comes to physician mindset, because there are essentially frontline workers having to deal with the death and dying, as you mentioned.
Yeah, and I don't know if you had the opportunity, but if you didn't, look at the interviews that we did on our website with physicians in different specialties in different parts of the country. From the epicenter in Georgia to a doctor who's on the front line there, to the chief medical officer and CEO of Cedars-Sinai Medical Group, who at the time wasn't really too nervous because things were under control back then, but now things have sparked up, and see that they were still worried even then that what happened could happen. And then from a place in Idaho where a doctor's saying they had virtually no COVID cases at the time, and then Idaho becomes a hotspot. So, but even those physicians who weren't hot at the time, you listen to them, and what they were dealing with and their fear and trepidation just stood out. And it was very noticeable how they felt.
Yeah. And if our listeners wanted to listen into those, are they on jacksonphysiciansearch.com?
Yes, they are.
Perfect. Now, what does the demand for physicians look like today? Like, will the supply keep up with the demand, and what does that look like?
The supply and demand since, let's see, gosh, I started in 86. The supply and demand since then has just continued to get out of whack.
Okay.
And if you think about it, it's pretty simple. The population growth has continued to get bigger and bigger, and will most likely, even with the pandemic, it's still growing, and population is going to continue to grow. So you think about that, and until the last month or so, there really hasn't been an increase in residency programs. Even when there were medical schools that were added, there was not an increase in residency programs per se. A residency program here or there in some specialties isn't going to make that big of a difference. There needs to be a significant change, and that's not going to happen overnight. And while those things are in place to try and build those programs, the population is going to keep getting bigger, and the doctor pool is not going to get any much bigger. And then you still have physicians that are retiring at a bigger rate all the time. So the pool keeps going down and the population keeps growing. So literally, I think in the next 10 to 15 years, the statistics show that there's going to be a shortage of well over 100,000 physicians. I don't know how you ever make that up. So, I think when I spoke to somebody the other day on a podcast about this, I said, I don't see that you will ever catch up. I think it's physically, mathematically impossible to ever catch up. So there will always be bigger need than there are physicians. And then, of course, you deal with the other subsets of that to say, for example, 20% of the country is rural, yet only 10% of the physicians work in rural areas. So it is kind of counterintuitive to what you would think. So there's a lot of things going on there, but to answer your question, go back to the easy question is no, I don't see us ever catching up.
Yeah, and you just talked about some aspects there. It was brought up on a previous podcast as well that you've got boomers retiring at an average of 10,000 per day. So that's obviously not helping much either. That's an increasingly aging population that adds to the equation as well.
Absolutely.
In terms of the impending deficit that we say essentially is sort of unavoidable, are there programs in place to try to keep some of the older physicians from retiring, maybe keep them practicing longer than they should? Not longer than they should. Let me rephrase that. Just practicing longer.
Yes, try to give them some type of reason or incentive to do more. And it's interesting. One of the things that the pandemic did bring out on the other side are people who were either very much nearing retirement or people had already retired, that you hear countless stories of people coming back to try and help. That's what doctors do, right? They're there to help people. When you reach out to doctors, in our case, when we reach out to doctors, sometimes we're reaching out to say, hey, can you help us? Do you know anybody who might be able to be a fit for something like this? It's just their nature to want to help people if you ask for help. So when they see these things happening and they know that there's a shortage, they jump back in, whether it was doctors, nurses. You're hearing incredible stories of nurses doing the same thing. So the pandemic really has brought some of that into play. Our last study that we did on attrition and on physician retirement, that was another thing where there was a big disconnect between what administration felt and what doctors felt. So, we talked to physicians, and one of the things that was clear was when you ask a physician, when you're ready to retire, what do you want to do? Where do you plan on going? And it was not playing golf every day or going for hikes. It was that, well, I don't know. I still probably want to practice medicine. Maybe I might do some temporary staffing work or things like that. Where, as I'm talking to administration, I'm saying, let's figure out how you embrace that and why have them fly off to go do locum tenens somewhere else when you can keep them right here, because you're going to have needs within your own community. So let's build a stable of some of those physicians that are still perfectly capable of working. They just don't want to work full time anymore. They want to slow down a little bit. So I think there could be great plans around that, but there is clearly, if you think there was a disconnect on this, the disconnect on retirement was even greater. So that paper's on our website as well.
From this study, what is ultimately your biggest takeaway that our listeners should sort of key in on?
There's old saying just in life in general, it's there's a lot of ways of putting it, but keeping a good client or keeping a good employee or something like that is much less expensive than having to go out and replace them. It's cheaper to keep her, right? So that's kind of the mindset to get in. And once you get somebody involved in your organization, your goal ultimately should be for every single person to stay with you until they're ready to retire. I mean, that's the end game that you should look at it like a marriage. People don't typically get married with the idea that they're going to be divorced in 10 years or 15 years. However, physicians many times feel like this is a stopping point. So how do you find those physicians and attract the ones that really have the need to be in your practice, where the family is a good fit for what the community is like, and the physician can practice great medicine and feel a part of the practice? If you can accomplish those things, your odds of keeping those people long-term are so much better. And then you don't run the risk of losing all that revenue. It doesn't just hurt from a revenue standpoint. As a hospital administrator, as a group administrator, you're very concerned about your patients as well. Your patients come first. Physicians second, patients first, maybe 1A and 1B. But at the end of the day, physicians leaving not just affect your top line or bottom line, but it also affects your patients, who are really what you're trying to do, what you're all about. So, there's plenty of reasons to have a good retention program, but you've got to start with making it known, letting physicians come in and know what the plan is going to be, and letting them know if there's ever any problems, what they can do and where they can go to try and remedy those problems. So if you can get these things in place, I think in the long run, it will make your specific practice, hospital, what have you, much more lucrative, profitable, and great for your patients at the end.
Yeah. Tony, I want to genuinely thank you for those valuable insights. In closing, I've got a few questions I ask all of our guests.
Okay.
First question is, do you have a favorite book or one you've read recently that you would recommend?
Oh, gosh. That is a really good question. I'm trying to think.
Some people stick to business books. Other people stick to sci-fi and favorites.
Really, I will tell you, especially because of this topic, I'm not doing this. He'll be glad I did. I'm not doing this as a shout out to Shane Jackson, but he wrote a book on culture. Okay. And Jackson Healthcare has been widely known for its culture locally, nationally, what we do and the programs that we do. And it's extremely insightful. It's not a tremendously long read, but it really helps put in perspective some of the things that he and his father have done over the decades since they started the industry. and the things that have worked out well, and just different ideas on how to do this sort of thing. So I would think that's a really good read for people who are interested in this topic.
That's a great recommendation. While we didn't cover that today, Jackson has won so many cultural awards, and that's definitely worth checking out. You can check them out online. Do you have a favorite quote?
I think my favorite quote is, if you take care of your people, your clients will always be happy.
Nice.
So, I had the opportunity to meet Richard Branson, and, I do think he was ahead of his time. And that's probably his favorite quote. And I'm
jealous. He's been on my list for a very long time. One of these days I have to meet Richard Branson. This next question, what has the last year taught you personally?
I think just to, more than anything, live life that's in front of you, and, take care of the things that are important, and me, it's, for me, first is family. And then there's my extended family, my employees. We've tried to build this in a way that we feel that, we want everybody to feel that this is one big family at Jackson Physician Search. And I think overall we do a good job of it. And when you do miss, or you do something that maybe isn't right, let people know how much you care about them every day. And don't let little piddly things get in the way of your relationships. Probably just take every moment and try to make it the best you can, and think that, in reality, what we've seen, 500,000 deaths, right? 500,000 deaths.
Yeah.
It really brings into perspective that you truly could be gone tomorrow. And, how do you want to leave those relationships, and how do you want to be remembered?
Yeah, that's beautiful. This final closing thought is for you, Tony. What would you like our listeners to know? Advice you would like to share with them? Any information? The floor is yours.
Thank you. I think, just keeping with the topic, it's important to continue recruiting. I would probably try to urge people to, when you're doing medical staff plans, it's so easy to say, this is what we need now, based on what the community and the population is, and the physician mix that we have. So people look at that and they think that this is what we need to do. However, they almost always forget about attrition. And when you think about physicians retiring, what's going to happen, physicians leaving for one reason or another, those things always come along. So build in some plans to recruit, and recruit for the future as well, not just what you need today or what you needed yesterday, but let's think a little bit further ahead. But take advantage of this knowledge and this type of information to prepare yourself to say, I won't have to long-term recruit as many people, because I'm going to recruit, and I'm going to make sure when people get here, they want to stay here, and set some type of goals. That's what we do here. I'm sorely disappointed if we ever have more than 10% turnover in a year. Then in our industry, that's unheard of. But if we do, then I feel like we did something wrong. So, that's the attitude I think medical groups and hospitals should take as well. And if they do, they're going to eliminate a lot of recruitment in the future, really, just by planning better and showing what type of retention and how you feel about your physicians from the beginning.
Oh, that's a wonderful way to end. Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.